Greetings, everyone. This is Eric Glazer, and welcome to Bright Spots in Healthcare, produced by Shared Purpose Connect. Each episode, we bring leaders together to not only inform you, our audience, but also unearth bright spots, successes at health plans, hospitals, and various healthcare-related organizations around the country. Our goal is to identify as many bright spots as possible so that you can determine if the ideas shared on our show can be applied at your organization. We believe this approach of finding a bright spot and cloning it is the most effective strategy to improve healthcare in our lifetime. Today, we're going to break down how Blue Cross Blue Shield of Arizona Medicare Advantage is reinventing the member journey. And to do that, we have two incredible guests and experts that will be joining us. The first is Phylicia Schroeder. She's the manager of provider engagement and quality analytics at the aforementioned Blue Cross Blue Shield of Arizona Medicare Advantage, and Janine Wakim, the head of operations at ReferWell. And we're going to cover during this interview, we're going to cover the member journey mindset. We're going to cover navigation and physician scheduling, data integration, risk mitigation as it relates to CAHPS, and finally, provider engagement. That all won't be all in a sequential order throughout the show, but we should be able to get all of that done in the course of this episode. So ladies, welcome to the show. Phylicia, I'd like to start with you if that's okay. And let's talk about how Blue Cross Blue Shield of Arizona Medicare Advantage is thinking differently about the member's journey and the member experience.
Wonderful. Thank you so much, Eric. I'm excited to be on the show. So one of the things that we're really working on instituting is a shift in culture that puts the members' needs above the plan's needs. It's fairly common to see how plans prioritize star ratings, CAHPS survey results, and that HCC recapture for risk adjustment in the culture of the health plan, which does tend to bleed into how we engage with our members. So essentially, as we kind of would know, right, these quality programs such as STARS and HCC recapture, these were truly designed to improve overall population health, which in theory, right, should be very patient-centric. But the thing is you commonly hear a grievance from patients about our healthcare system as a whole is not being treated as an individual, but rather a case. So of course, that is not often the intent of the health plan or even maybe their providers. But until we're actually truly intentional about a shift in that culture, we could potentially end up treating patients and members, I guess I would say, just kind of, again, as a case. So we really want to change that to be more individualistic. And one of the ways we truly are doing that is we're using data and predictive analytics to really learn about what makes our members unique. And so we ingest available data from our claims data, mock surveys for CAHPS. We've got the grievances, complaints, and truly overall, what are members doing to engage with their health plan so that we can figure out maybe ways that we can address concerns that they have, or even maybe some comorbidities that they have, chronic conditions, as well as even potential social determinants of health, such as an inability to maybe get to their appointments because there's a transportation issue, things of that nature. So it is, again, really trying to tailor our communication style and our experiences with our membership.
Go for it. I'm going to summarize that just so we captured all of that for everyone, prevent them from having to press rewind. So the tailored experience is sort of what I heard you talk about. And you said the core to it is prioritizing the member needs over the plan needs. So that was the thing. And then you said you're going to take a very data-focused predictive analytics approach to this all. And you talked about bringing in a lot of different data points into the approach. One of them you said was member complaints, if I caught that right. You're going to bring member complaints. You're going to talk about how members normally engage with you guys as well, and then ingest data from claims and CAHPS to thoroughly understand the big picture so that it becomes less of a transactional relationship and more of an ongoing relationship. Did I summarize that okay?
Absolutely. The one thing I want to emphasize is CAHPS is anonymous, and so we can't ingest actual regulatory CAHPS data. We can do those mock surveys, but you got it right, Eric.
Right. And can you talk a little bit about what you mean by like analyzing member complaints? I mean, is that by each individual member, or are you taking them all in a whole and grouping them into categories? How does that work in your approach?
Yeah, so essentially what we have is that we have a predictive analytics tool where they are able to actually kind of analyze a ton of data. It's proprietary. I don't know anything about how they do it necessarily, but essentially they're able to tell us what members are potentially at risk for reporting maybe negatively on a CAHPS regulatory survey in those various domains. But specifically when it comes to grievances, complaints, we obviously do actually have data about when they've reported a grievance or a complaint in the last 12 months, and we can actually look at the occurrences for that information. But in addition to that, they also have like voluntary disenrollment percentiles where we can look at that information too. So we're really getting a holistic view of potentially what could be causing a barrier for our members to have a good experience. And is exactly as you said, we want to end that transactional relationship and one, also be more proactive in addressing their concerns before we get to the place of having a grievance or a complaint.
I like that. I like that. Anything else about this tailored experience approach that you want to add on before we move to the next question?
Absolutely. And so I just want to emphasize, obviously, culture shifts, especially systemic ones, they do take time to grab hold and truly to make change. So we still are in our infancy of seeing that change in the Medicare Advantage space and seeing those subsequent results. But one of the areas that we are actually tailoring our experience is we are partnering with a vendor who is completing member outreach for us. And we're giving them that data then that they can have those conversations with our members. And the idea would be that they're building personal relationships and providing a concierge service. And so that's what we're currently doing to start piloting that experience.
Like that. Good segue. I'm going to bring in Janine Wakim. She's the head of operations at ReferWell, which could be potentially the aforementioned vendor partner that Phylicia was talking about. Janine, can you tell us a little bit about the navigational process, how it works, and how you're able to not only maintain a continuity of care, but also, go a long way towards ending that, traditional transactional relationship?
Yeah, I'll be happy to. And I took away so much of what Phylicia said as well, Eric, and I'll summarize one point that resonated with me, which was treating members as an individual, not as a case. Now, to do that, I'm going to talk a little bit about how we communicate with members later, but let me talk about planning for success, because any successful outreach is predicated on some fundamental components. And those fundamental components, so we can plan for success, include provider outreach and member outreach. So on the provider outreach side, due diligence is key. As we're preparing for a campaign, we want to make sure that we are communicating with the PCPs of the attributed members shared by Phylicia's team. We're advising those PCPs about the program, its benefits, and in fact that the navigators will be reaching out to their offices, to confirm phone number, admin name, fax number, address. All of these things end up getting sent to the members. We want to make sure that it's accurate and it's crisp, part of making sure that we have a seamless member experience in the end. We also want to understand if the office is taking new members. Some of them don't, or take new patients. If they don't, if we have a list of unattributed members, we have to make sure that we gear them to someone who does. And that's also part of creating a seamless experience for the member. We'll try to get calendars if we can. That's really important because we want to make sure that we are booking an appointment at a time that's convenient to the member. But whether we book on calendar or not, having that relationship is absolutely fundamental. And the reason people talk about booking directly, it's not that there's something fantastic about booking directly, but booking directly enables a shorter time to appointment. And so when we can reduce the time to appointment, the sweet spot's really going to be less than 3 weeks, then we know show rate goes up, and it can go up by 2 times. So what's the value? Phylicia is talking about improving member journey, people taking control of their healthcare, improving their better health outcomes. So here they are about to take advantage of that referable moment, or that moment where they can get on a better health journey. We want to make sure that we set them up for success so that they show up for the appointment and create that virtuous cycle. So that's some of what our team does. Then once you've done that legwork, you speak with the member. So, we will work with the member. We'll have the list provided by Phylicia's team. If the member is amenable to it, we'll schedule the appointment right on the platform, directly if we can do it. And then we'll also follow up. It's critically important at the moment that we've scheduled that appointment, they get a reminder via text or email, whatever is their preference of the appointment, then 2 days before, then 1 hour beforehand to improve show rate. If the patient misses the appointment, because we follow up on those as well, we'll reschedule them. If the member tells us, hey, I got your back, sister. I already booked it. I took care of it. We'll capture that information and we'll share it with Phylicia's team.
A couple of follow-ups. So if I heard you correctly, you call it almost like a two-pronged approach. And if I provider outreach and member outreach, correct?
Yes.
Provider outreach, you work with the providers and book these appointments directly with the offices. The goal is to reduce time to appointments to approximately 3 weeks or less, because setting up that member for success starts with getting a quick and timely appointment. So those are the key things that are there. I also heard your member outreach, where you're working directly with the member to understand availability, when you should be doing those schedules. And once it's been scheduled, follow up reminders, and then also follow up for missed appointments. Are you following up post-appointment as well, or no?
Yeah, there's a survey post-appointment that the member receives by text to share information on how that appointment went. And so if they went to the appointment, they get a survey to ask how it was. And if we follow up with the office and the member missed the appointment, we will reschedule it for them.
Janine, are you guys doing anything in addition? So if you got that member on the phone, and yes, you are there to talk about getting them to that appointment and schedule that appointment, are you able to take advantage of that time with them to do anything in addition to that?
Absolutely. For Phylicia's team and for any health plan, if there's a survey, if we want to ask questions, at that moment when a member feels comfortable, then we'll be able to ask them additional questions. Some members will have other issues. We'll have a member who will say, hey, I'd like to get the rest of my family at the same dentist. Or, I only have one car that I share with my husband. Can you call that office and also schedule my husband for an appointment? Or I need to speak to member services because I'm concerned about, some of my benefits, or I'm not sure. The care navigation team has an extensive playbook, and we will handle additional support services. It's key to have a member feel supported and heard. Very often, and I don't want to go off on a tangent too much, but we all know it. Some members receive a lot of communication from different groups. These people know they need help and they're overwhelmed and they may have some fatigue. And to whatever degree this single person can support them navigate multiple issues, it's so much more of a better experience for them.
Yeah, it sounds great. It sounds like a real gap in our whole process right now. I'm going to bring back Phylicia Schroeder, Blue Cross Blue Shield of Arizona, MA. Phylicia, how are you leveraging the data? Because you talked about data earlier. How are you leveraging your data right now to drive a better connection with the individual members beyond some of the items that you talked about earlier as it related to just the complaints and some of the clinical data? How are you leveraging data in different ways to build that relationship?
Absolutely. So one of the things that we're actually doing is we are running a pilot this year, which is going to be a data-driven concierge, or a white glove, essentially is kind of our air quotes that we're calling it. And so we are taking that data, as mentioned previously, to basically kind of identify which members we probably want to touch base with, which is those ones that are at higher risk for possibly having a poor member experience. The other piece of it then is we're using information about maybe what they're using for their over-the-counter benefits. So over-the-counter benefits are typically a health plan will offer a certain dollar amount to the member to be able to purchase different items like medications or like blood pressure cuffs, you name it. And so For example, Blue Cross Blue Shield, we're very aware that we're not educating our members so much on that because the number one thing that they purchase is Band-Aids and Q-tips. When they have the ability to potentially purchase rails for their bathtubs so that they could potentially prevent risk of falling, or blood pressure cuffs, maybe a better glucose monitor. And so I will say that obviously varies by contract as far as what we're able to offer them with that OTC benefit. But that's another example of how we're going to tailor that experience to educating them on ways that the health plan provides resources them to improve their overall health. The other piece of that too is that we have virtual events available for our members. We've got health fairs. All of these things are intended to improve the quality of care that they're receiving. So it would be partnering with, say, ReferWell to outreach to these members, which is exactly the partner that we are working with to do this concierge program and execution. But finding and identifying, hey, we've got these virtual events that are maybe related to nutrition, getting them signed up for it and helping walk along their journey. So not only are we doing that on the provider side, right, where we're helping them get the appointments that they need for their gaps in care, as well as their PCP visits, but we're also helping them alongside just our general benefits that we offer them. Because once again, there's a lot of skepticism around health plans, I think, for members. And most of the time, honestly, the attitude is like, they're just trying to take my money. And so the reality is that we actually do genuinely care, and we are using resources to be able to help improve their health. And the best way that we can do that is to partner with ReferWell and use this data as well to identify, as again, members who are at risk potentially for not having the best experience.
So we might as well give the folks some details about ReferWell. Let me just say this to everyone listening. One of the multiple privileges I get when by hosting and producing this show is I get to meet with a lot of different interesting companies, and based upon where we go with the programming of this show allows us to choose the folks that we ask to become part of it as sponsors. We don't necessarily have to take anyone and everyone who's willing to give us a check. We could be very strategic in how we do it, because we always want the companies that keep the show going to also be able to add value to all of you, to be able to provide thought expertise. And I think we've proven that over the many years now, going 10 plus, that we've been producing this show for all of you. So I want to give a shout out to the supporter of this episode and one of our signature partners of the show, ReferWell. Health plans, as we've already alluded to, are acutely aware that they're measured and graded on quality, experience, and health equity more so than ever before. And the biggest challenge is to directly impact each one of those areas. So what ReferWell actually does for all of the plans in the audience is advance health equity and access by scheduling these underserved members for the care they need, whether it be medical, care gap appointments, or through your own community partnerships, make appointments for services like transportation assistance, nutritional counseling, mental health services, and other CBO offerings that the health plan has that you want to be able to make sure are being utilized and leveraged by your members. ReferWell has these care navigators, and they're able to find the perfect match right at the referable moment when the member is leaning into their care, and be able to schedule the member while they're on the phone. It's a proven process. You sort of heard Janine allude to it earlier, that provides much better access, experience, and outcomes for each one of your members who goes through this process, and it allows you to have a better quality performance as a health plan, which of course affects your bottom line. So I want to thank ReferWell for being a supporter of the show. You can check them out at referwell.com. And I want to bring on back on Janine Wakim. And Janine, can you talk about how MA plans should be thinking about mitigating risk, and specifically thinking about how they mitigate the risk of members who may contribute to lower CAHPS scores?
Yeah, that's a great question. I'll rephrase it this way. So CAHPS scores come from member experience. So if you're worried about CAHPS scores, then you're concerned about member experience. And then the next the next thought is, how can we take steps to make a positive difference? Think about the member population. Does the member does the member you're going to speak to speak Spanish or Chinese? The data that comes from Phylicia's team identifies preferred language, which is helpful. Does a member have other healthcare concerns? What if they have transportation issues? And when I say transportation issues, we made a mention of maybe a family member relying on another family member for transportation. But what if you call someone and their catalytic converter was stolen that morning? Not that we are mechanics, but to say that there are other stressors in life. Member experience is much more than customized messaging. That's important. Member experience is much more than leading with empathy. That's critical. Member experience is both of those things, plus the ability to navigate and triage. And and through these issues, we're able to address and understand these other stressors and still help members stay on their journey. Let's say the member has no transportation because her catalytic converter was stolen that morning. Do you still call and tell the member, you know what, so sad, too bad, let's get you scheduled? The right answer, I believe, in fact, is, can I find a date when I can call you back? Is there a better day and time? If a member needs back-to-back appointments for him and his wife because only one of them drives, well, you have member network information, and you have the providers in their area that accept the health plan details, and you can make both of those appointments. And like I had mentioned, some members are receiving many calls from different services. We know it. These patients are absolutely aware of what they're missing, and they need someone on the other line who can take over some of that legwork.
Great. It's great. And when we talk about the combination of the member experience with data, Phylicia, can you tell us a little bit about how this impacts the overall strategy at Blue Cross Blue Shield of Arizona's MA? How would you describe that?
Absolutely. So one of the goals, essentially, if you have an ideal quality program, again, I emphasize ideal because we're still working on getting there, is a concept of synergy. So ideally, you should have, what we're doing at the health plan level should be in sync with and synergize with what we're doing with our providers. And ultimately, how do you find that information out? You use data to inform if you have synergy or you do not. Because obviously data is any type of information that you're gathering and collecting. So the more information we have, the better. And so one of the pieces that ReferWell plays for us is obviously because they have that two-pronged approach where they have the member engagement and the provider relationship that they're establishing, they essentially are pulling in that synergy for us. And so when we talk then with our providers, so on the provider space, where if I'm engaging with them, discussing things with them, we're obviously giving them their members' care gaps. They're ingesting that into their EMR systems so that when ReferWell, for example, reaches out to a PCP and schedules a member for their appointment with their PCP, ideally, then we have now fed that data to that PCP, and then they can close those gaps in care. In addition to that, then we're also then leveraging value-based contracts that have embedded incentives to help engage them in those quality activities. So the idea is that we're hitting all areas that we possibly can to improve that member's experience, that journey, and ultimately improve their quality of care. I know one of the barriers that we have been recently informed of, actually by a panel of providers that we do meet with, is they basically had said, you know what? We understand quality. We know what the HEDIS measures are. We know what risk adjustment is. But we want the health plans to understand is one of our biggest issues in the state of Arizona is we have a shortage of healthcare professionals. So there's a significant access to care issue in the state of Arizona. And so that's essentially what they're like, help us solve that issue. So that's, again, where maybe ReferWell is very helpful, because then they can identify a group of providers. So let's just say with our colonoscopy program that we had, our colorectal cancer screening, they partnered with GI specialists that we specifically identified carried the lion's share of our demographic population. So for example, if the geography was concentrated in one specific area, they then reached out to those GI specialists. So they had just kind of an instant connection there. So we're really trying to improve that access to care issue. And so that's another area where we're having that synergy, is because we've got providers on the other side saying, we need help here. How can you help us? As well as, right, the administrative costs associated with calling members, outreaching to them, getting scheduled for appointments. I know plenty of people who call into their, phone lines and they are on hold for 15 minutes. So we actually kind of cut that off as well with ReferWell, where we're outreaching to them and we're like, we want to help you get scheduled, instead of someone having to call someone and wait on hold for 15 minutes to get an appointment. And by then they've given up. So that's really, again, how we're kind of working that in. So.
Can you explain at a high level, like what was the lift to implement when it comes to using a third party like ReferWell and integrating them into your customer service and gaps in care program like you have been? Like, how hard of a lift is it? Could you explain to everyone, is this just a literally open the box and it's ready to go? Or is there a key assembling? Could you explain that to us?
Yeah, that's a really great question. So obviously, data, right? Getting your data prepared is going to be one of the most critical pieces. And so on our side of Blue Cross Blue Shield, what we were responsible for was we partnered with ReferWell. We had something called a solution designs workshop where we basically designed the program that we're trying to do, our campaign. And so we would then prepare the data that we need to send to them. ReferWell has been fantastic at pretty much ingesting anything that we need them to ingest and adapting very quickly. I think that makes the implementation a lot easier for a health plan, is flexibility. And that is exactly what ReferWell has offered to us. And then reporting as well, is that when I gave them feedback about like, hey, I want more data, give me more information, they were able to add more dispositions, you name it. I would say probably the biggest lift is you're going to be your scripting, and defining what kind of conversations you want to have with the population. But ReferWell has done a really great job at formulating the scripts, and then obviously us providing feedback. So ultimately on our side, it has not been that difficult. I think the biggest lift is actually on ReferWell's side, with creating those partnerships and relationships with providers and obviously implementing the data.
So I just want to summarize that, and maybe Janine, I'm going to have you come in and comment as well. So Phylicia, I heard just you have the data prepared. That's number one. Two, you guys hosted that solution design workshop. Was that a one-day event? Was that a couple of days?
A solution design workshop, Phylicia, it's a one-day event that's a kickoff, and then there are weekly meetings. I'm right? Yes.
Yes, and it's not necessarily one day as in like 8 hours. We probably meet for an hour or two and then design everything.
Okay, I like that. Yeah. And then the scripting for the members, which you guys start, but then or ReferWell starts and you guys modify them, and you have to go back and forth and all that.
Exactly.
From your perspective, Janine, what are you guys doing to make sure the lift for implementation and the resources required, mindshare required, is minimized for on the health plan side?
Well, a lot of what Phylicia identified as data management, program management, that's all scalable. There's process, there are playbooks. Our care navigation team has a 250-page playbook that's been established. And so we have some tailored scripting, and we can pull that, and then we work with Phylicia's team for specific programs. Likewise, for the data, we have a very robust data warehouse. And because we've worked with Phylicia's team before, we only need to upload new PCPs or new providers. And so it's a lighter lift at each iteration. So those are the things that, and those become routine. And I get it, and we all get it. We want what's great, and you have to do the right things to get a great outcome. And so those are the right fundamental things we do, and we try to do them very quickly so we can get to the member outreach part, which is a lot more meaningful, at least right away for the end user.
So Janine, as we're kind of coming towards the close of this conversation, I'd love for you to talk a bit about, and this may be, some of it may be repetitive or a nice reminder, but what are the key components to scheduling navigation that are so important. And then I'm going to ask you as a follow-up about execution. And I'd love to get some examples from you too, because I just want everything to be crystal clear in everyone's mind's eye here.
Well, I'll mention the soft skill, and I'll say it, and then you can guess what I'm doing. Eric Glazer, Phylicia Schroeder, Janine Wakim. You may not guess what's happening, but before a member picks up a phone call, a care navigator will say that member's name out loud. A care navigator will look at that member's age. I know because I'm at a certain age where if I get an email that starts with "hey," I don't quite love it. And so you need to know who you're speaking to sometimes. When Phylicia's team gives us a member list with preferred language, which they do, we make sure that a care navigator who natively speaks that language is calling them. You meet members where they are. Likewise, another key success factor is having an incoming line where when a member calls back, that phone call is routed to the navigator who outreached to them initially. So it is, Phylicia at the start of this call talked about treating people as an individual, removing the relationship being transactional. Now you're using technology to have a member reach that person, have that ongoing navigation, so that when the member calls back, it goes back to that original navigator. You can also increase member comfort by being able to schedule appointments at specific days and times that suit the member. That sort of touches back on all of that pre-work and then why it makes a difference at the end. So when you combine all of these processes with leading with empathy and listening without judgment, you really are improving the member journey and helping members improve their health outcome when they're ready.
How are you, I got a sense of how you're executing, but can you give us behind the scenes and how this all gets executed so effectively, and maybe even provide us an example so we fully understand?
Yes, I'm happy to, and I'm laughing a little bit because we run retrospectives with our care navigation team about every 2 weeks. And part of it is to really fully understand the member profile and for them to share member stories. Phylicia referenced our GI provider program, scheduling members for colorectal cancer risk. And so I'll give an example of, along that line to have some continuity. Sometimes you will call a member and they already know who's the best provider in the neighborhood. Such is the case, in this example that I'm going to give you. So the member was receptive to the call and said, yes, and I want to be scheduled with this provider. They must have heard it from a neighbor or a friend. Okay, but it wasn't, someone that was on our list provided by Blue Cross for members for CRC screenings. So our care navigator followed up and found out, in fact, that this is a doctor that did not do screenings, for general consults, just diagnosed conditions. So our navigator did their homework and actually found a doctor in network that did accept general consults and was right across the hall from that original provider. Goes to the point of establishing who the networks are and knowing who's who and who's on our list in the area. The navigator also was able to adjust the PCP because the established PCP that was given on the list to us was not the one that the member stated. So we worked with Phylicia's team to adjust the PCP. Once all of that is done, the care navigator sets the member up in the network with the provider network that she wanted, the next best provider that she wanted, set her up with the right PCP, and then set her up with the reminder emails and texts. And by the way, the member had a new contact phone number, so we adjusted that for the texts as well. This is a more complicated scheduling for the member. And if you think about it this way, that's all of that complicated scheduling, that's what the navigator sees. The member's experience is seamless. They're just seeing one side of it. So everyone has their stories, and most members don't share theirs. Oprah said once, everyone has a story that will make you cry. I don't know what it is about Eric that made me think of Oprah, but it did. And a lot of times members don't share their story. In this case, the member called back because we had the incoming line. and called back our navigator to say thanks. Why did she say thanks? She said thanks because this member is also taking care of her adult disabled daughter. The member was not only experienced fatigue managing her family's health, but she really also didn't have time to manage her own. And she had location constraints that she needed to work around, which explained why she wanted that specific provider as well. Having the inbound line enabled the member to call back the care navigator. Sometimes they could call back the navigator to just check up on things. This one called back to express her appreciation. But I think that sort of sums up how the process is important and the outreach works to really get to that non-transactional individual member experience that Phylicia's team is looking for.
Great story. Yeah, Phylicia, can you, just to close things out here, share with us some of the results of your overall sort of synergy strategy and tell us a little bit about how it's working out for everyone over there?
Absolutely. So I wanted to add one little thing to what Janine said that I just popped into my head is how, we were talking about the member or the patient had basically wanted one provider because they heard word of mouth, this was a great GI specialist. And then it turns out that wasn't in their plan. I think that tends to happen sometimes when you talk about referring amongst providers is that they have an ideal specialist in mind, but that doesn't necessarily mean their health plan would cover it. So that's obviously too, it sounds like we're ReferWell. Obviously that referable moment really takes place and is that you're able to actually help them then find a provider because honestly, a lot of people have a hard time, going and doing the find my provider on like websites, things like that. So I just wanted to emphasize that as another piece to the success there. But as far as like our results go, so for example, this year, to start off our year, we did run a campaign to get our patients and members in for annual physical exams or annual wellness as well. And so we sent a list to ReferWell of those members to get that done at the beginning of the year. Because ideally, right, in the perfect world, the first thing that should happen for anyone is just the most holistic approach is to get them in for an annual exam. And then that annual exam should have then the quality that follows. So we gave that list to ReferWell. And so as far as the results that we have observed so far for this, so give or take, to be realistic, we should anticipate roughly about like a 8 to 10% completion of getting those members scheduled for an appointment. And so ReferWell got about 8.4% of that population scheduled. And then when we're talking about the show rate, which I would say is even the harder layer to add to this, they got a show rate of 84% of our members. And so to me, that's very impressive because I feel like, now I know this is subjective to some extent, but it shows that there's a relationship that ReferWell is able to establish with the patient so that then the patient then executes and follows through with their appointment. It also reflects that follow-up and the continued, I guess you could say, communication to get to them to that point. And so, because there's some level of right where if someone maybe says, okay, yeah, I'll schedule an appointment, and then they're like, I really just did it to like accommodate or, out of obligation, but we're actually seeing that follow through. So there shows a necessity for this service. So that's an example of some of those results we've seen. In addition to that, we also had a campaign for breast cancer screening. Another example of that would be how we're looking at, again, about roughly actually more like 5 to 8% for scheduling when we reach out to them to get a mammogram is more realistic. And ReferWell hit it at about 8.5% of that population with a show rate of 75%. And that actually also is very, very impressive. So that is an example of the effectiveness of that relationship. And so again, we're really excited to see how even this concierge approach then could potentially change a member's perception and experience with their quality of care.
Great stuff. Love this. How can people get in touch with you guys? LinkedIn, social media, what can you share with everyone? I'm sure there could be some follow-up questions for all of you. Phylicia?
Yeah, I do have a LinkedIn. I have a very unique name, so I should be fairly easy to find. So Phylicia Schroeder, and then obviously my title is on there as well. So that would be, I think, a good way to reach out to me.
And how about you?
So for me, Janine Wakim, it rhymes, and LinkedIn, email JanineWakim@referwell.com, or if you get on our website, there's a button for, I think it's called Let's Chat or something like that, and someone will connect back to you if you click on that.
Love it. Thank you for all this. Thank you both for all the time and all the great content you just provided all of us. Really appreciate it. To our audience, I like saying that, this is your show. We produce each episode with hopefully insights for you. We choose the topics based upon your feedback, and we hope that you use bright spots shared today on this episode to at least inspire your thinking, or maybe even create new ideas to clone/copy some of these components at your organization. As I like closing and reminding everyone and saying, this is your Bright Spots in Healthcare podcast. Until next time, everyone. Thank you. Thank you again, both of you.